How do you reduce bruising and swelling after blepharoplasty as much as possible so you can get back on the road to recovery? What are things you can do as a patient, and what are things your doctor can do to help you recover as fast as you can? I'm Dr. Chris Theagaraja. Let's dive in. So after cosmetic eyelid surgery on the upper and lower eyelids, you're going to have bruising and swelling, and that's the nature of any surgery. Most patients really want to know how they can reduce their swelling and be presentable as soon as possible. There are lots of factors at play, and generally speaking, there are things that patients can do to help reduce bruising and swelling. And everyone's going to have some. There's no way to eliminate it completely. The other side of the coin is that all bruising and swelling eventually goes away. One of the most important things that patients can do to reduce bruising and swelling is to stop any medications or supplements that promote bruising and swelling. And there's a long list of supplements that I'm listing here that really contribute to bruising and swelling after surgery. You want to stop that at least a week in advance. Additionally, of course, any blood thinners, those are going to thin your blood and make you bruise and bleed more. But along with that, there are other medicines that most patients don't think about, like Motrin, that you want to avoid a week in advance. The second thing you want to do is make sure you're set up for success in your recovery. Your bed's set up so you can sleep on an incline, you have your ice packs ready. That way you could do all the things to optimize your healing and reduce bruising and swelling, especially in those first 2 to 3 days when they tend to show up. The third thing that patients can do that really people don't talk about is optimizing your health before the surgery. Patients who have high blood pressure and poor health tend to have more bruising and swelling before surgery. Anything you can do to optimize that beforehand is going to help reduce that recovery period just by making you a healthier person. Finally, there are things that your doctor is going to do during the procedure that really can help to reduce bruising and swelling. Less aggressive surgical techniques are going to reduce bruising and swelling in black and blue, and that's really dictated by your surgeon what he does intraoperatively. There's also tranexamic acid, which has been shown to reduce bruising and swelling. Because the medication increases clotting, you have to weigh that out against your personal history. If you've recently had blood clots, you probably don't want to add that into the mix. But for most patients, it's a safe addition. I use it in almost all my patients, and I think it really helps to reduce black and blue, bruising and swelling right after surgery, and the data supports it. So I hope that gives you a good summary of what you can do as a patient and what your doctor can do to help reduce bruising and swelling and speed up your recovery. I'm Dr. Chris Theagaraja. Have a great night.